sentinel lymph node biopsy in carcinoma of the breast is done if lymph nodes are palpable, breast mass with no lymph nodes palpable, breast lump with palpable axillary node, metastatic carcinoma of the breast. Okay, so this is a straightforward question. If you know the theory, then it is easy. The answer for this question is breast mass with no lymph node palpable. Okay, let us go to the discussion about the sentinel lymph node. So what do you mean by sentinel lymph node? Okay, so let us consider this is the tumor. Okay, let us consider this is a carcinoma of breast lump, and this is the lymph node. Okay, the sentinel, as the sentinel literally it means to guard, that means it protect. Okay, so the lymph node, so consider this is another lymph node is there, then another lymph node is there, like that. Okay, so the tumor cells, the regional lymph node metastasis will happen, the tumor cells will spread. Okay, the tumor cells, consider this is the tumor cells, these all the red dots. The tumor cell will spread to the regional lymph nodes. Okay, so that will be received first by a lymph node. Okay, first by a lymph node, and after receiving, it is not giving the tumor metastasis to other cells. That is commonly, if it is if it is metastasis going from here only, it has to go to the second node, from there it has to go to the third node. Okay, sentinel lymph node is the lymph node that receives the tumor cells from the primary tumor. Okay, and it protects. So beyond that, generally it is not going to the other lymphatics. So that we are using to take the biopsy. Okay, so what are the indication in case of carcinoma of the breast? What are the indication? Here the indication is clearly given, that is all the early breast cancer, that means T1 T2 with N0 lesions, which is, in other words, I want to tell that any lesion that is less than 5 centimeter in size and there is no node at all. Okay, that means a clinically palpable lump with a size less than 5 centimeter with no lymph node is not palpable. In that cases, you can plan for the sentinel lymph node biopsy. Okay, then what are the conditions it is not indicated? There are some indication. There are some conditions it is not indicated. Number one, a clinically palpable axillary lymph node. The reason is very simple. Already the lymph node is enlarged. That means if the lymph node is enlarged, definitely the other lymphatics also will be involved. That is the inference. So in that case, there is no role for the sentinel lymph node biopsy. And second reason is multifocal. Okay, even if you are planning to take out this lymph node, the multifocal and multicentric disease, the lymphatics can involve from in any aspect. So there is, and that condition also it is not indicated. Then what are the agents you are going to use to test this biopsy? Number one is called a patent blue, which is nothing but a dye, isosulfan vital blue dye. Number two is technetium 99 radioisotope labeled albumin or sulfur colloid. Okay, so these material commonly used in detecting the sentinel lymph node. How will you do the procedure? Okay, sentinel lymph node biopsy, how will you do the procedure? Okay, so this is the tumor is there. Okay, tumor is there, and consider this is the whole breast, and this one is the nipple and areola. Okay, and This one is the lymph nodes. That is the, this is the whole red color is the sentinel lymph node. So what you have to do, you can inject the dye. Already I told about the dye. You can inject the dye either in peritumoral area, around the tumor area. Before surgery, you can inject peritumoral area, or else you can inject the dye in the subdermal plexus around the nipple. Here, subdermal plexus around the nipple. In these two regions, you can inject the either the dye or the technetium 99 isotope labeled albumin. You can inject here. Okay. Then once if it is injected, then it will go into the tumor site. Okay. So this will go into the lymph node site, that is a sentinel lymph node. Okay. There you can able to identify if the if you are injecting dye, blue dye, and this will become blue in nature. Okay, so this will become blue in nature. Or if you are injecting albumin, radioactive isotope, there you can pick up by using gamma camera. You can pick up that, so you can diagnose. So you try to identify the sentinel lymph node and take the whole thing for biopsy, particularly frozen section biopsy. Then you can plan that whether it is a positive or negative. If negative is there, then you limit your resection. If positive is there, then you can plan for the axillary dissection. Okay, so this is the last one, that is what are the contraindications of the sentinel lymph node biopsy. As the dye, I told that commonly it produces an allergic reaction, sometimes anaphylaxis also, and it's contraindicated, and pregnancy, inflammatory carcinoma. And complications, if you inject the dye, the blue tattooing of the skin will be there, and blue urine, the color will change, and allergic reactions and seroma. These are all the complications and contraindications of the sentinel lymph node biopsy.